Scientists just proved that plastic is turning your kids into walking chemistry experiments, and the health costs are bankrupting America. A massive NYU study reviewing hundreds of research papers found that childhood plastic exposure causes obesity, heart disease, infertility, autism, and ADHD, with healthcare costs reaching $250 billion annually. Here's what they're not telling you. Every time you microwave food in plastic containers or give your child a plastic water bottle, you're releasing phthalates, bisphenols, and PFAS chemicals that disrupt hormones and rewire developing brains. The study tracked thousands of pregnant mothers and children, proving these toxins cause lifelong damage that extends into adulthood. Microplastics are literally embedding in your child's organs, triggering chronic inflammation and immune system dysfunction. The plastic industry has known about these dangers for decades, but spent millions lobbying against regulations. Over 100 countries are calling for legally binding caps on plastic production through the UN Global Plastics Treaty, but the industry claims economic concerns outweigh children's health. When your toddler's sippy cup is more toxic than industrial waste, maybe it's time to question why we're feeding our kids from poison containers.
Rural hospitals are being systematically shut down in what amounts to healthcare genocide against small-town America. 760 rural hospitals are at risk of closure, with 314 facing immediate shutdown, leaving millions without emergency care. Here's the conspiracy. Republicans created a $50 billion rural hospital stabilization fund that sounds generous, but is actually designed to fail. The fund requires hospitals to meet impossible criteria, while Medicaid cuts ensure they can't survive anyway. Dr. Oz recently boasted about this fund on social media, but got brutally fact-checked by lawmakers who revealed it's woefully inadequate. The real agenda is forcing rural Americans into urban healthcare systems controlled by private equity firms that can charge premium prices. When your nearest emergency room is 2 hours away and you're having a heart attack, those extra miles become a death sentence. Small towns are being deliberately starved of healthcare to consolidate power in corporate medical centers. The closure of rural hospitals isn't market forces, it's calculated elimination of healthcare access for politically inconvenient populations. Every closed rural hospital represents hundreds of preventable deaths the politicians are willing to accept.
Healthcare providers and insurance companies are running the biggest theft operation in American history, and they just got exposed. A new investigation reveals a hidden scheme where providers and insurers work together to systematically overcharge patients through illegal billing practices that go far beyond simple upcoding. 2 Florida men were just charged in a $34.8 million Medicare fraud involving fake medical equipment and phantom services that were never provided. But this isn't isolated fraud, it's systematic theft built into the healthcare system itself. The scheme works by creating fake medical necessity, billing for services never rendered, and splitting the profits between providers and insurance companies while patients get stuck with massive bills. Medicare fraud investigators found that billing patterns consistently don't match actual documentation, meaning patients are paying for treatments they never received. The American healthcare system isn't just the most expensive in the world, it's the most corrupt, with providers treating government programs like personal ATMs. When your medical bill includes charges for equipment you never used and procedures you never had, you're not getting healthcare, you're getting robbed by people in white coats.
Scientists just discovered cancer's secret weapon, and Big Pharma is trying to bury the cure. Researchers found that tumors use a hidden hormone to completely shut down your immune system, allowing cancer to grow unchecked while your body's natural defenses stand helplessly by. This breakthrough explains why immunotherapy fails for so many patients. Cancer is literally hijacking your immune system's off switch. The scientists tested a drug called WNT974 that blocks this hormone, and the results were incredible. Tumors that were previously unstoppable suddenly became vulnerable to treatment. But here's where it gets sinister. This research is being suppressed because it threatens the entire cancer treatment industry. If cancer can be stopped by blocking one hormone, what happens to the hundreds of billions in chemotherapy profits? The drug exists right now, sitting in research labs while cancer patients are told there's no hope. Combination therapies using this hormone blocker are showing promise for the most treatment-resistant cancers, yet clinical trials are mysteriously underfunded. When a simple hormone switch could save millions of lives, but pharmaceutical companies make more money from prolonged suffering, every cancer death becomes a business decision.
DuPont and 3M have been poisoning you since the 1970s, and they have the documents to prove they knew it. Newly released internal memos show these chemical giants knew PFAS forever chemicals were highly toxic when inhaled and moderately toxic when ingested 50 years ago. Yet they continued production and covered up the dangers. These companies didn't just hide the truth, they actively developed strategies to deceive regulators and the public about PFAS health risks. Military veterans are now filing massive lawsuits over AFFF firefighting foam exposure, revealing how these chemicals were knowingly used in products that poisoned the people protecting us. The cover-up involved falsified safety studies, bribed scientists, and regulatory capture that allowed deadly chemicals to contaminate drinking water nationwide. PFAS chemicals don't break down naturally and accumulate in your body forever, causing cancer, liver damage, and immune system destruction. The companies knew this would happen, but calculated that profits outweighed human lives. Court documents show executives joking about poisoning people while shareholders got rich. When chemical companies treat your family as acceptable casualties in their profit war, every glass of water becomes a potential death sentence.
CDC medical experts are literally scared to speak publicly because they're receiving death threats for telling the truth about health dangers. Healthcare professionals who try to warn the public about safety issues are being intimidated, silenced, and threatened with violence by people who profit from keeping Americans sick. Hospital ward closures are being branded as betrayals, while safety and staffing concerns become major problems that nobody wants to address. The intimidation campaign is working. Doctors and researchers are self-censoring rather than risk their lives to protect public health. This isn't just about COVID or vaccines, it's about any medical professional who dares to challenge profitable but dangerous practices in healthcare. When scientists discover environmental toxins, pharmaceutical side effects, or medical device failures, they face coordinated harassment campaigns designed to destroy their careers and silence their warnings. The threats are coming from multiple sources: industry-funded trolls, political extremists, and corporate interests that view public health information as a threat to their bottom line. Medical conferences are now hiring security because experts fear for their safety when presenting research that challenges profitable medical practices. When telling the truth about health dangers becomes a life-threatening act, we've entered a new era of medical fascism.
Insurance scammers are stealing billions through ghost broker schemes, and you're probably their next target. Action Fraud received 817 reports of ghost broking in 2024, a 24% increase from last year, with average losses reaching over $2,000 per victim. These aren't small-time criminals. They're sophisticated operations that create fake insurance companies, sell worthless policies, and disappear with your money, leaving you uninsured and financially devastated. The Florida Attorney General is suing roofers who deceive customers about insurance claims, revealing how widespread these schemes have become. Ghost brokers target vulnerable populations who can't afford legitimate insurance, offering policies that seem too good to be true because they literally don't exist. When you get into an accident and discover your insurance is fake, you're liable for all damages, plus criminal charges for driving uninsured. The scammers use professional websites, fake credentials, and stolen insurance company logos to appear legitimate while stealing your premiums and personal information. Medicare scams are exploding, with criminals tricking elderly victims into paying fake fees, premiums, and copays while stealing their Medicare numbers for identity theft. When insurance becomes a criminal enterprise, every policy purchase becomes a gamble with your financial future.
Toddlers across America are walking toxic waste dumps, and a new study proves it's worse than anyone imagined. University of California researchers tested urine samples from 201 children and found 111 different toxic chemicals in their tiny bodies. Chemicals linked to cancer, developmental disorders, and lifelong health problems. These aren't teenagers or adults who've had years of exposure. These are toddlers who've barely been alive long enough to walk. The study reveals that children's textiles contain PFAS forever chemicals and organophosphate esters that transfer through skin contact, meaning every piece of clothing becomes a delivery system for toxins. Sweat amplifies the transfer, so active children absorb more poison through their skin during play. The chemical cocktail includes pesticides, flame retardants, plasticizers, and industrial solvents that disrupt hormone development and brain function during the most critical period of human development. Parents think they're protecting their children by buying organic food and filtered water, but the real danger is hiding in their clothes, toys, and furniture. The chemical industry has turned childhood into a toxic exposure experiment where every breath, touch, and movement introduces new poisons into developing bodies. When 2-year-olds have more chemicals in their blood than industrial workers, we've crossed into chemical warfare against our own children.